Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center on the coronavirus. Today is Friday, May 29th. Wow, it's almost June.
It's
incredible.
It is.
It's incredible. Let's take a look at the graph that shows those people who are currently admitted to the hospital in the 8 counties of the Capital Region. You can see this graph looks very much like it did yesterday. There are 96 people currently in the hospital, and there are 13 in the ICU. Fred, we talked about this yesterday. It's pretty much a very flat graph at this point.
Very, very flat, absolutely.
Okay. Let's take a look at the graph specifically about what's happening inside here at Albany Medical Center. Let's pop that up. We currently have 39 in the hospital that we're currently treating for COVID-19. 35 on the floor, 4 in the ICU. We're back to 0 on ventilators, so that person was on and they came off briefly.
That's right.
So we've dipped under 40, which is great.
And we have 13 folks that are COVID positive ready to be discharged, and in that number, in that 38 number, the congregate living nursing home population.
So when we look at that graph again, we see that break point where the solid purple line goes out and the dashed purple line goes down.
Right.
That dashed purple line would be what is the population inside here in the medical center if those patients were back in nursing homes.
That's right.
All right. The other number we talked about yesterday was the demographics of age, and I can actually update that. Now the youngest person in the hospital is 48. So it's definitely a population which is in the 40s and above, at least here in the medical center. Fred, you mentioned congregate living facilities. There's 33 in here.
33
and
today, yes.
That's here inside Albany Med.
That's right.
We talk about avoidable days. I think people now understand what that is. We've described that. You actually have the number of avoidable days in the region.
That's right, Dennis. So we've been trying to share with each other on our regional call every morning, all the hospitals that get on that call. So 6 hospitals today had their numbers, and it's an unbelievable number. It's 665 avoidable days. And just to give you some sense of what that means, that's enough days to have cared for about 125 patients from start to finish.
And
given the length of stay they normally have.
We call those bed turns, right?
That's
so
right.
You could have turned over a bed in 5 days for a patient with those bed days
that's
available.
Right. 125 patients could have been cared for in those bed days. Very significant.
We are talking a lot on these videos about safety. Yesterday we mentioned the milestone that we had gone over a month and a half since we had a nosocomial case, which is the transmission here in the medical center to a patient of COVID-19. I mentioned we were hitting another milestone, and Fred, I'll let you do this one. This has to do with members of our workforce.
So Dennis, it's been a month since we've had a member of our workforce test positive. And remember, we've tested over 1,000 members of the workforce,
right,
and not one of them has tested positive in a month.
So over a month now for patients and staff without getting COVID-19 inside this facility.
That's right.
You know, before we even knew about COVID-19, we were, like all hospitals, surveyed by the Joint Commission.
That's right.
People probably have heard of the Joint Commission. They are a group of, they're an entity that does accreditation for hospitals. They send, on behalf of the federal government, they come in and they look at your organization against a standard, hundreds of standards, maybe thousands of standards,
yes,
and they say how well you perform. And there's chapters devoted to infection control. The most recent Joint Commission survey came in. They found no issues with infection control here inside the medical center.
That's right, and that was late this past fall that they were here. And as a matter of fact, infection control was one of their focus areas,
right,
and we had no findings.
And I mention that because it's an example of where the medical center had safe practices in the past, as demonstrated by the Joint Commission, and then these most recent numbers as well.
And you know, Dennis, we're right down the street from the Department of Health, being here in Albany, and they not infrequently come, yes, and survey us, yes, for a whole host of reasons, and they don't usually find any issues either.
Yeah. There was another milestone moment yesterday, which we'd like to call out, related to negative pressure rooms. So Fred, if you would again, describe what a negative pressure room serves the purpose of doing and what we did.
So Dennis, when we have a patient with COVID, and we're going to do procedures that are aerosolizing. So we're going to give them an inhaler treatment, mm-hmm, or suction a patient on a ventilator, those kinds of things. We want them to be in a negative pressure room where all of the aerosolized particles get sucked out. Okay, so a lot of our rooms are negative pressure. Inherently, it's built into the HVAC system inherently. But as we got into this, we created a whole bunch of incremental rooms that are negative pressure. And that involved getting some equipment and hooking it up such that we could make that airflow negative. Well, today actually, we decommissioned, I think, our last area that we had brought live with negative pressure above and beyond our standard negative pressure. So that's another huge milestone for us.
And that lines up with the decrease in the ICUs and the ventilators.
All of it.
And we can only do that type of work because we have an incredible facilities team which does that type of work.
They're fantastic, absolutely. Yeah. I think within 2 hours they lit up some of those negative pressure rooms for us.
Tomorrow is Saturday. Fred, a year ago, if we went back a year ago, were we doing surgeries at South Clinical Campus on Saturday?
Only in our dreams.
Okay. And so tomorrow's Saturday. Are we doing cases at South Clinical Campus tomorrow?
Tomorrow is the first day of Saturday cases at South Clinical. Shout out to the nursing staff, the administrative staff that have set this up, and particularly the providers that are going to be working, the anesthesiologists, CRNAs, and physicians. Not only are we doing cases tomorrow, but we have cases booked through all of the Saturdays in June. And I got an email earlier today, they're starting to look at July Saturdays. So Dennis, this is something that's going to allow us to catch up, but also this is going to be something that I'm looking forward to being sort of a permanent feature of the services we provide our community.
Can you explain how doing cases on a Saturday helps us with the idea of social distancing as well?
Well, it kind of flattens the curve of our volume.
Right.
Instead of doing more cases on a Wednesday, if we push some of them into a Saturday, that's less congestion in all areas of that facility. Plus, some of the cases that we're going to do on a Saturday are children.
Right.
In the normal world, when they're in school, they wouldn't have to be pulled out of school. Their parents won't have to take time off from work. So the convenience factor here is enormous, as well as the social distancing aspect of this.
Thank you. And I think it's important to mention that because it's part of our post-COVID-19 strategy to do cases on Saturday, and that's another great example of it.
And we intend to start Saturday cases on the main campus in 2 weeks.
And we'll talk about that then. All right, let's take a look at our attire. Now, it takes a very special moment for me not to wear a purple tie.
So Dennis, I have to say, I have never seen you in anything other than a purple tie.
It's unusual. So to make up for it, I wore a purple shirt. But I specifically wore this tie today, which has some lovely animals on it. And I wore it because Doug Cohen, who's a veterinarian here, and who leads our animal resource facility, reached out to me and said, you know, veterinarians are also considered essential employees. And he and his team have been here from the very beginning, and we really appreciate his work and the team's work, and I'm very proud to represent them today wearing this tie.
Shout out to them.
For sure. And what about you, Fred?
So I have a Kaizen t-shirt on, courtesy of our group that is involved in continuous quality improvement or continuous improvement activities across the house. Don Weisenfeld sent this t-shirt to me. And I think Don wanted to make the point that we've done a lot of changes to deal with COVID, but we need to continue. We need to continue to improve on not only our response to a situation like this, but continue to improve in all aspects of the care we provide here in the medical center, which we're absolutely committed to.
Absolutely.
So thank you, Don.
Thank you for sure. So, Fred, our first video was on March 16th, and when we did this...
Was it that long ago?
It was that long ago.
Wow.
We believe it's 54 videos we've done.
54.
And when we started to do these, what was the reason why we wanted to do these videos?
We wanted to get information out to our staff and the community about what was going on, and we wanted to do it in a soothing, calm way without any of the hype that sometimes is out there in the media.
Right, and I hope we've accomplished that. And we were talking, Fred and I, that going forward, although we are still dealing with COVID on a regular basis, we believe it's time to start turning our attention to other areas as well. And one of the ways in which we're going to do that is we're going to change up the cadence and the frequency of these videos going forward. So rather than doing them 5 days a week, we're going to start with a Tuesday and a Thursday. We'll certainly be available if something breaks over the weekend or if there's something we need to talk about on Friday, we'll do that. but we'll do it twice a week. And in addition to talking about COVID, we're going to talk about other issues as well.
That's right. This has been a wonderful way to communicate to our staff and to the community about what's going on inside the medical center. So we're going to continue to provide that information in this format.
Right. So if you're a member of our workforce, you'll continue to get emails on the days we do videos, so you won't have to go looking for them. If you view the videos from the outside on social media, it'll still pop up on your feed on Facebook. Or if you watch this on YouTube, you'll get an alert if you're a subscriber. And if I'm not mistaken, Fred, when we started this, we had 200 people who were subscribers to the Albany Med YouTube channel, and I think we crossed over a number recently.
We did. So we started with 200. We now have 2,000 subscribers to our network.
Which is great, because I think we have a great story to tell on this campus, and we're so proud to be able to deliver that. And so to those people who watch it through YouTube, they can get an alert on the Tuesday or Thursday when we do that as well.
We do a lot of great things in this organization, and this is going to be a great way to communicate that out to the world.
On other things other than COVID as we go forward.
That's right.
And we will still talk about COVID, because we're still dealing with it every day, but there are other things we're going to talk about as well.
That's right.
All right, very good. Well, we're going to head into the Friday, or to the weekend, that's it, and we'll be back again next week on Tuesday.
On Tuesday.
Unless something breaks over the weekend.
That's right.
All right, very good. Thank you, Fred. I ask that you all please please take care of yourself, take care of each other, and we'll see you next week.